Hello everyone, and today I've come up with a new topic, that is extrapyramidal syndromes. Now another very high yield topic, very important topic, whether it is your university examinations or your entrance examinations. A lot of questions if from the antipsychotics are asked, they're asked from this particular topic, extrapyramidal syndrome. So let's get started with it. I am Dr. Deepika Tikku from Simply Pharmacology channel. If you like my videos, please do subscribe, and also to put in the comment section any suggestions or any other videos you would like to watch. I will surely look into them. So let's get started. Yes. So before I actually get into the extrapyramidal syndrome, so let's just have a brief overview of what are we actually discussing. There's a problem somewhere in the dopaminergic pathway. So let's first have an idea what are the dopaminergic pathways in our central nervous system. So here I've tried to actually, make 4 important dopaminergic pathways. The one in the blue, which I'll be marking from this one, I hope you can see this, right? This is your mesolimbic pathway, right? So mesolimbic pathway, as I've said here, this is your mesolimbic pathway. The one in the black, let's get the black color going. And from again starts from here, and they can go to this pathway, and this pathway in the prefrontal cortex. This is your mesocortical pathway. So let's come to the yellow ones, the yellow pathway here that we have from the hypothalamus and pituitary. This is your tuberoinfundibular pathway. And the one in the green, this one, this is like your corpus striatum के साथ जो mix करता है substantia nigra, and that is your nigrostriatal pathway. So all these pathways, they are at the dopaminergic pathways and very important in their own sense. So what actually happens in this pathway, like mesolimbic and mesocortical pathways, they are mostly अगर वहाँ पे dopaminergic levels की derangement होती है, वो mostly involved होता है in the pathogenesis of psychosis result करते हैं, like schizophrenia that we talk about. So psychotic symptoms occur because of this. So जो mesolimbic pathway है, what happens in cases of psychosis in this particular here problem is that in mesolimbic pathway there is supposed to be excess of dopaminergic levels. So जो ये blue वाला pathway हमारा इधर है, this one here, so there is excess of dopamine, ठीक है? There is excess of dopamine, and this dopamine acts on the D2 receptors in this limbic system here, and this continuous stimulation of this D2 receptors, this gives rise to the positive symptoms of schizophrenia. The positive symptoms of schizophrenia. Mesocortical, so it is not the excess of dopaminergic pathway or dopaminergic innervation. उल्टा इसमें opposite होता है. इसमें क्या होता है? They say there is a decrease in the dopamine in the mesocortical pathway. So decreased dopamine in the mesocortical pathway, and that leads to the negative symptoms which is seen in the patients of schizophrenia. So they have thought disorders, they cannot speak, प्रॉब्लम्स इन आर्टिकुलेशन, बोल नहीं पाते हैं, और स्पेशली इमोशनल फ्लैटनिंग रहता है रिस्पॉन्स का, ठीक है? सो देयर इज़ नो हाई लो, एक जैसा फेस रहता है हाईज में या लोज में, सो दैट काइंड ऑफ थिंग्स. वेल जो ट्यूबरोइन्फंडिबुलर पाथवे है, दिस वन द येलो वन, इसमें क्या होता है बेसिकली इन दिस, देयर इज एक्चुअली इट इज़ कंसर्न विद प्रोलैक्टिन रिलीज, ठीक है? प्रोलैक्टिन रिलीज होता है यहाँ पे, and this prolactin is under the control of dopamine, जिसको हम कहते हैं prolactin inhibitory hormone. So this is actually dopamine. So whenever here the dopamine levels are high, they will have a inhibitory effect on prolactin. इसका मतलब prolactin levels कम रहेंगे. पर जब आपके dopamine levels कम हो जाते हैं because यहाँ पर D2 receptors by chance block हो जाते हैं, so your prolactin levels, they go really high, and that leads to condition called as hyperprolactinemia, or in women उसको galactoria के पे it will actually present as, and in men as gynecomastia. The nigrostriatal pathway is very important pathway that we will be doing in details in my videos of Parkinsonism. So they are concerned with Parkinsonism-like features. Parkinsonism. So whether there is deficiency of dopamine or there is blockage of D2 receptors here, so they lead to Parkinsonism-like symptoms, shuffling gait and all those kinds of things. So सब जगह पे dopamine involved है और उनके अलग अलग functions है. तो अगर यहाँ पे D2 receptors actually they are the main receptors. So D2 receptors का main hand होता है. तो अगर कोई drug इनको block करती है D2 receptors को, so all sides of side effects can. So जो हमारे reason हमारा क्या है, जो आपके drugs होते हैं, for example antipsychotics, especially your typical antipsychotics. जो typical antipsychotics होते हैं, for example we have haloperidol and we have flufenazine. So these are very potent typical antipsychotics. They work by blocking the D2 receptors in the brain. So actually they are given for schizophrenia because of this problem. There is excess of dopamine and you want to bring down this problem. So what you do, you give a D2 blocker, which is typical antipsychotic. So therapeutic response इसका limbic system में तो अच्छा है because it will decrease the positive symptoms of schizophrenia. Yes, mesocortical पे इसका कोई ज़्यादा रोल नहीं है because they don't have because actually वहाँ पे decrease in dopamine, तो ये दो और decrease कर रहे हैं, so उधर negative symptoms में they don't have much role. But in the tuberoinfundular pathway में भी आपका D2 receptor present है, यहाँ पे भी D2 receptor present है in the nigrostriatal pathway और वो भी block हो जाएगा. तो उसके वजह से जो problems आएंगी patient को हो जाएगा hyperprolactinemia and your Parkinsonism like symptoms and the other symptoms जिनको हम कहते हैं extrapyramidal syndromes that we are going to do. So this is the reason for the extrapyramidal syndrome. So the important drugs are your typical antipsychotics. So again they are caused by typical antipsychotics. ये older antipsychotics हैं और उनमें से भी the drugs which are most potent, and हमने जो most potent drugs की, that is your haloperidol and flufenazine. Also other drugs, any other drug which blocks the D2 receptors in your brain. So we have a drug also called as metoclopramide. ठीक है? So this is also a D2 blocker. So it is used as prokinetics and in the GIT chapters में ये होती है drugs देखी जाती है prokinetics antiemetics में. So because this drug crosses the blood-brain barrier, so it is actually इसका side effect होता है D2 blocking action. इसके जैसी एक और drug है वहाँ पे पढ़ते हैं, that is domperidone, which is used as a antiemetic. It has a similar mechanism like metoclopramide. ये भी D2 blocker ही है. But ये जो D2 blocker है ये सिर्फ outside the CNS करती है in the CTZ. So जो उसको antiemetic action है वो इसका domperidone का आता है. But because it doesn't cross the blood-brain barrier, it doesn't have the side effect of EPS. And that is why metoclopramide crosses the blood-brain barrier and it has the side effect of EPS. It is not that much preferred. We prefer domperidone for those conditions. So these drugs actually cause the extrapyramidal syndrome because they block the dopaminergic receptors. D2, not the others, only D2. And when they block the D2 receptors, by blocking them in the mesolimbic system, they are causing their therapeutic effect. By blocking them in the other areas of the brain, they are causing their adverse effects. So let's do a detail of what actually are the syndromes in the extrapyramidal syndrome actually. So you can remember these all are the extrapyramidal syndromes. The first one is acute muscle dystonia. So acute muscle dystonia means it occurs the earliest. Acute symptom है, जल्दी आता है. उसके बाद over a few days, akathisia, Parkinsonism like symptoms, some also call it as pseudo Parkinsonism because actual Parkinsonism कब होता है जब dopaminergic neurons degenerate जाते हैं. तो इसमें degenerate तो नहीं हो रहे, इसमें हम D2 blockers दे रहे हैं. Because of that there is Parkinsonism like symptoms. So it is Parkinsonism like symptoms or some call it as pseudo Parkinsonism. Then we have tardive dyskinesias, and this is the last one to occur. It occurs very late, over years, sometimes even decades, and when we stop the drug, then these conditions can occur. And the last one is Neurolept malignant syndrome, and इसका कोई time नहीं है, ये कभी भी हो सकती है. So there is no time कि days में होगी, months में होगी, हो भी सकती है, नहीं भी हो सकती है. So it is not time dependent at all, right? So जो first 4 हैं, there is a mnemonic which you can remember by ADAPT. ADAPT. AD is for acute dystonia, A is for akathisia, P is for Parkinsonism, and T is for tardive dyskinesia. So remember, this one occurs at the earliest and this occurs सबसे late. So almost your first 3 plus ये 4th है, they are because of the D2 blocking effect. ठीक है, जो first 3 and the last Neurolept malignant syndrome है just due to blocking effect. Only tardive dyskinesia is because super sensitivity of the receptors. Super sensitivity of the dopaminergic receptors. We'll see how it occurs, but this is the difference between them. So let's get to it one by one. Acute muscle dystonia. So it is acute, occurs very fast, earliest in hours or maybe another day, 1 or 2 days mein jayega. And what happens, there is spasm of the muscles around this, mouth, they get spasm. Oculogyric crisis, very commonly asked, what is this due to? This is because of acute muscle dystonia. Sign of acute muscle dystonia, oculogyric crisis. So around the eyes, जो muscles हैं, ये भी contract. So I'm looking up like this, right? So muscles are getting contracted. Even there can be contraction of the neck muscles. ऐसे टेढ़ा हो जाएगा, तो उसको कहते हैं torticollis. ठीक है? So actually how I relate or learn this is, if you see, all of you must have, seen Mr. Bean. He's a very good comedian and he has so many movies and all. So, whenever I see him, because he has got those typical eyes, very wide open eyes, and most of the time his face is very wide, and, so I imagine him with this expression. I saw him somewhere in a movie where he was looking at, I think, an Eiffel Tower or something, and that has struck me, that face, that facial features. So I relate that to acute muscle dystonia. With all due respects to Mr. Bean, it is just that I remember the symptoms of acute muscle dystonia by this, remembering his face. So this is oculogyric crisis. So orolingual muscles, they get contracted, and the torticollis. This is a way of remembering, the side effect of this. And the treatment for this is your anticholinergics. Because we know that in your central nervous system, there is a balance between the dopamine and the acetylcholine. So, अगर किसी वजह से ये dopamine नीचे चला जाएगा, so relatively there will be high levels of cholinergic activity. So, because of the high level of cholinergic activity, these signs and symptoms, they start occurring. So what do? You have to decrease this cholinergic activity, and so you give anticholinergic. But we cannot give any anticholinergic. We only can give the anticholinergic which crosses your blood-brain barrier. और वो anticholinergics हम classify करते हैं as centrally acting anticholinergics. So why not we are giving atropine? Because it doesn't cross your blood-brain barrier as such. So the drugs which cross the blood-brain barrier and have the effects on the cholinergic receptors in the central nervous system, they are called as your centrally acting anticholinergics, like benztropine, benzhexol. So they all belong to this class. So this is a drug which can really benefit this particular problem. Akathisia. Akathisia, it is one of the most common side effect, EPS में से most common, and it appears in a few days, and there is restless in the patient, and patient, you will see he's sitting in front of you, and either he is doing something like this, irresistible है, he can't control it, or he is constantly, इसका जो leg है वो tap कर रहा है, suppose ये leg है ऐसे tap कर रहा है, ये जैसे हम कभी करते हैं वैसे नहीं, जैसे म्यूजिक सुनते हैं tap करें, no, वो करता रहेगा, it is not in his control, he is so restless, or he will be walking around That is the degree of restlessness. And because of this restless attitude, they become really anxious. Anxiety हो जाती है उनको कि they don't know what to do. They are so helpless. So for this particular problem, the treatment is that you decrease their anxiety levels by giving a beta blocker. Like you can give propranolol. So it is used in anxiety states, like when somebody has a stage fright or कुछ ऐसे होता है, you give these beta blockers because they decrease the sympathetic overactivity, anxiety and all that is decreased. So beta blockers can even help in this condition. और अगर आपको और एक group दे सकते हो for calming down the patient, these are benzodiazepines like diazepam. You can give these drugs. They are better in this. And then you can always again give centrally acting anticholinergics. जो हमने किया, centrally acting anticholinergics. So that's the treatment for akathisia. Pseudoparkinsonism. So it is just like the Parkinsonism signs and symptoms where there is decrease in the movement, bradykinesia, shuffling gait. So there is rigidity, cogwheel rigidity, masked face. So all the same things which occur in Parkinsonism, all symptoms are seen here also. Again, for drug-induced Parkinsonism, the treatment is always centrally acting anticholinergics. Benzhexol, benztropine. You can also give a drug which is like promethazine. This is actually an antihistaminic drug but also possesses anti-muscarinic activity. It crosses the blood-brain barrier, right? So these are the two drugs which can be given for pseudoparkinsonism. Tardive dyskinesia has actually a different mechanism as such. It doesn't belong to the other key. There's deficiency of dopamine. No, it occurs after many years of treatment, and it can occur when you stop the treatment also. And there is involuntary orofacial. There is like chewing gum, lip smacking. ऐसे आवाज निकालते हैं ना, lip smacking ऐसे आवाज निकालते हैं. Obviously अगर public में ऐसे बैठे होते हैं तो it looks very bad in public, right? So those kinds of orofacial movements. And the problem with this is, as soon as this starts, one should stop this typical antipsychotics, because if you are allowing them to continue, what happens is that they can become irreversible. It is difficult to treat them later on. So 50% of cases are irreversible. So that is so high. So as soon as the first thing that you actually see कि आपको लग रहा है कि tardive dyskinesia की तरफ patient जा रहा है, you need to stop the therapy. And sometimes it happens that you have stopped the therapy and then this can occur. That is the problem with this particular drug. So what actually what they tell कि why is it developing is because of super sensitivity of the dopaminergic receptors. Because what happens, let's say this is your dopaminergic neuron and this is a postsynaptic जहाँ पे D2 receptors present हैं basically, ठीक है? So D2 receptors usually block किए गए हैं by giving the typical antipsychotics. Dopamine here is stored in the vesicle. It is being synthesized, it is being stored, it is being released, ठीक है? But the problem is it can't act on the receptors. It will act on the other receptors but not on the D2 receptors because they are blocked. So, and then gradually it will be metabolized and the effects are going to be over. So if you suddenly, suppose you have now stopped giving the drug after so many years, आपको पता है जब continuously antagonist present होता है for a long period of time, तो क्या होता है receptors को, some receptors either they'll be increase in the number of receptors, जिसको हम कहते हैं up regulation of receptors, more D2 receptors they start coming up, ठीक है? और and they become super sensitive also. So it's like अगर हमें बहुत देर तक खाना नहीं मिलता तो हम we are getting hungrier and hungrier and hungrier day by day. तो जैसे ही खाने का वो भंडार खुल गया, हमारे पास खाना आ गया, because हम बहुत भूखे हैं, we taken a lot of food. So this is what happens with them. They take, as soon as you stop giving this typical antipsychotics, so their number is high, their sensitivity is high. So when the dopamine is there, because of no block, it can act on these receptors, and that leads to the signs and symptoms of tardive dyskinesia. So here we do not need to give a drug which is a dopamine blocker, because already the problem is occurring because of that. So what here we can do, अभी तक तो कोई ट्रीटमेंट अवेलेबल नहीं था इसके लिए. इट वाज दैट्स व्हाई. सो अगर आपको टिपिकल एंटीसाइकोटिक्स दे रहे हो, द बेस्ट बेट वाज दैट यू स्टॉप गिविंग द ड्रग एंड रिप्लेस इट विद द atypical antipsychotic, give this drug a try, clozapine, atypical antipsychotic, because these drugs don't have that much effect on the D2 receptors or so. Now what they say is there are new group of drugs coming which here they block the storage of dopamine. अब जब ये dopamine synthesize होती है actually, तो dopamine gets stored in the vesicles. If dopamine does not get stored in the vesicles, वो इधर उधर भटकती रहेगी और इधर उधर भटकने से ये मेटाबोलाइज हो जाएगी एंड इसका इफेक्ट खत्म हो जाएगा. सो इट हैज़ टू बी स्टोर्ड इन द वेसिकल्स टू रिमेन देयर, अदरवाइज इट विल बी डिस्ट्रॉयड बाय द एंजाइम्स. सो यहाँ पे देर आर ट्रांसपोर्टर्स विच ट्रांसपोर्ट डोपामीन इनटू द सिनेप्टिक वेसिकल, और जो ये ट्रांसपोर्टर हैं उनको कहते हैं VMAT2, वेसिकुलर मोनोमीन ट्रांसपोर्टर टाइप 2. सो VMAT ट्रांसपोर्टर्स होते हैं. सो व्हाट ड्रग्स अभी हमने ग्रेजुअली बनाई है, तो दे आर गोइंग टू एक्चुअली ब्लॉक दिस को, इसको ब्लॉक कर देंगे न्यूअर ड्रग्स. तो अगर वो VMAT2 को ब्लॉक कर देंगे वो ड्रग्स, तो जो डोपामीन है दैट इज नॉट गोइंग टू बी स्टोर्ड इन द वेसिकल, इट वोंट बी टेकन अप एंड स्टोर्ड इन द वेसिकल, सारी बाहर जाएगी तो वो मेटाबोलाइज हो जाएगी. सो दैट मीन्स द लेवल ऑफ डोपामीन यहाँ पे कम हो जाएगा, और जब लेवल ऑफ डोपामीन कम हो जाएगा तो जो सुपर सेंसिटिविटी का इशू है जिसकी वजह से टायराइड डिस्काइनेसिया प्रॉब्लम्स हो रही थी, दैट विल बी रिड्यूस्ड. सो दैट इज व्हाट दे आर ट्राइंग दीज ड्रग्स. सो दीज ड्रग्स आर valbenzine and deutetrabenzene. So these are VMAT inhibitors. They inhibit the VMAT2 so that dopamine doesn't go there and doesn't get stored, and its level will definitely decrease. So that is one therapy which is being tried now, the latest therapy. अभी तक पहले इसकी कोई ड्रग थी ही नहीं for tardive dyskinesias. And the last one we have the Neurolept malignant syndrome. So it is a very, very serious condition which is an emergency. It can occur anytime and it is life-threatening. And life-threatening by I mean 20% mortality cases are there. So what happens in this here, there is high-grade fever. There is rigidity, the muscles are rigid, so it's called as lead pipe rigidity. लोहे की पाइप को अगर आप पकड़ो कितनी हार्ड होती है, तो इतने हार्ड वो मसल्स लगते हैं, कितने हार्ड हो गए. इट्स कॉल्ड एज lead pipe rigidity. Tremors, right? And there is immobility, कहाँ मूव करेगा इतना rigid body. Myoglobin in the blood. So if there is myoglobin in the blood, it can go through the kidneys, called kidney failure, and it can be really, really fatal. So for Neurolept malignant syndrome, what to do? You have to stop the therapy. There is no way you can continue the therapy. It is life-threatening. So you have to stop the drug. And second option is you can give a drug called as dantrolene. ठीक है, dantrolene दे सकते हैं, because dantrolene का क्या रोल होता है in the muscles? If you remember, this is the muscle. Here let's say, and the contraction of the muscles actually occurs because of the actin myosin. और actin myosin की contraction के लिए क्या चाहिए? Calcium. So calcium कहाँ से आता है? From your sarcoplasmic reticulum in the muscle. ये stored होता है calcium इसके अंदर. So whenever there is a stimulus and this calcium, it will get released from the sarcoplasmic reticulum. And there are receptors which are guarding this release. They are ध्यान रख रहे हैं कि कितना कैल्शियम जा रहा है बाहर. They are called as ryanodine receptors, right? So these ryanodine receptors, they manage कितना कैल्शियम बाहर जाएगा, and this calcium will go and act, and it will cause the actin myosin contraction. So यहाँ पे क्या हो रहा है? Excessive contraction. Rigid muscles हैं. We want them to relax. So we do not want a lot of calcium to go out, और कैल्शियम बाहर ना जाए. इसके लिए हम एक ड्रग दे सकते हैं जो राइनोडाइन रिसेप्टर्स को ब्लॉक करेगी. अब जब राइनोडाइन रिसेप्टर्स ब्लॉक हो गए, बिकॉज दे अलाउ फॉर द मूवमेंट ऑफ कैल्शियम आउटसाइड, so they will not allow any calcium to go out. So this dantrolene is a ryanodine receptor blocker, so no calcium can actually go out, and therefore there is no actin myosin interaction, and there will be relaxation of the muscle. The third treatment is that you can give dopamine D2 agonists like bromocriptine and all, that can also be given to treat this condition. So these are the various treatment modalities for the extrapyramidal syndromes. So these are very, very important extrapyramidal syndromes. That is acute muscle dystonia, akathisia, pseudoparkinsonism, tardive dyskinesias, Neurolept malignant syndrome. So acute muscle dystonia occurs at the earliest, tardive dyskinesia is the latest to occur, सबसे last में after years. Neurolept malignant syndrome, there is no time. Baki akathisia, pseudoparkinsonism occurs in midway. So if you remember, the mnemonic adapt in the same way they are occurring. Pehle dystonia, then you can remember akathisia, Parkinsonism and tardive dyskinesia. Now, acute muscular dystonia, the treatment is important for acute muscular dystonia. The treatment of choice is centrally acting anticholinergic like benztropine. So is the treatment for pseudoparkinsonism as well. Akathisia ka major treatment is related to the anxiety, that is you give propranolol or diazepam. Then you can also try centrally acting anticholinergics. So in all these three, there is actually the dopaminergic D2 receptor block which is triggering this. D2 block की वजह से सारा problem आ रहा है. Tardive dyskinesia actually कहते हैं कि उसमें there is super sensitivity of the receptor. I told you वो उल्टा ही mechanism. It is not D2 block. It can occur once you even stop the therapy over a period of time. So your receptors have become, because of the continuous presence of the antagonist, which is your antipsychotics, your receptors have become super sensitive. And so when you suddenly remove the antipsychotics, तो क्या होगा? Dopamine तो पहले से ही formed था इतना. So all of that will affect your super sensitive D2 receptors. Remember, बहुत भूख लगी है उनको, so they're taking a lot of food, which is dopamine, and the tardive dyskinesia symptoms occur because of that. So इसमें the management actually is to decrease the level of dopamine. So by giving the vesicular monoamine transporter inhibitor, like we have valbenzine and deutetrabenzene. So they will not allow the storage of dopamine. So that dopamine is not stored in the vesicles, and if it is not stored in the vesicles, बाहर रहेगा तो definitely attack करेंगे, बाहर enemies हैं, उसके enzymes हैं, वो उसको destroy कर देंगे. It has to, क्योंकि वो घर के अंदर नहीं जा पा रहा, vesicles में नहीं store हो पा रहा. The last one is Neurolept malignant syndrome, which is actually very serious emergency condition. And here, the one, we need to stop giving the drug and you give something which relaxes the muscles, because muscles have become super rigid, super hard. And so relaxation of muscles can be given by a rhinodine receptor inhibitor, which is your dantrolene, or you can give a dopaminergic agonist, because this is also because of D2 block. So these are the various extrapyramidal syndromes and their treatment. Again, they are really important for the examination. So hope I made myself very clear in this video, and I hope I made the topic clearer to you. So do let me know your comments and I'll definitely read them. So thank you so much.